COVID has been a major issue in the world. So from the start in December last year, and that was in, I'll just put it in Wuhan, in Hubei province in China, where the people started noticing there was unexplained cases of pneumonia being reported. And by that time, people think that it will just probably just finish in China, but it keep expanding. And in January already, the WHO named it 2019 novel coronavirus. And 2 weeks later, they able to define it as a major public health on an international level with significant concern. And in February, they finally gave it a name of coronavirus disease 2019 because it was discovered in 2019. From there, it became a pandemic, and it was very quickly, it expanded in the world. The main reason for this is that about 80%, 85% of people with this disease show minor symptom or no symptom at all. So for that reason, it's easily moving on the street without knowing that they are sick, but still being potentially able to transmit the disease. So this is one, it was a theory that started in this wet market. And scientists believe that it came from the bats. And there's a clear genetic, oh, can you see again a slide or is gone? Oh,
yeah. Okay.
Yeah, we can see.
That is that. Yeah. So there's a clearly genetic evidence, about 85%, 90%, according to the studies, that it came from the same coronavirus linked to bats. So where are we now? We can see that about 5 million, more than 5 million have been affected, and about 335,000 people died from this virus. And it has involved almost 188 countries. And in Australia, we're doing very well, I would say, not really well, with just about 7,000 affected people and 103 confirmed deaths. So, having said that, the concern now, the main reason for this presentation is to see how that can impact people with sickle cell. Before that, I'll just briefly tell you how it is transmitted, because that will help us to understand how to prevent it. I think we all know now, because of through the media and public health officials, education, that there mainly is contact transmission. So it's when the patient is coughing or sneezing or even talking, so some viruses can go in large droplet and can be on the surface or can go straight away to another person if you're not far enough, at least 2 meters from the other person, because it can go up to about 6 feet. And there's also now increasing evidence that again airborne transmission, whether the virus can be suspended in air for some time is safe to be determined, but it's clearly concerned about that. On the solid surface can stay up a couple of days. Some studies say 4 days or 5 days. So I think for now, there's certainly a lot of unknown. This is how we can get it. I think the most important thing is really looking at social distance, looking at your hand, not touching many surfaces, because that's how you can easily get the virus from there and take it to your nose or to your mouth or to your eyes, to any mucosa. So this is just to show you how far it can go. So you can see Ebola is just about 3 feet, but coronavirus can go up to 6 feet. So the best precaution would be to take at least 2 meters between you and another person. who can transmit this is important. We have to assume everyone is suspect, and particularly is asymptomatic. So people who have no sign or minimal sign can see transmit the disease. Obviously, the transmission can start from 2 days from when you get it, but roughly to be around 8 days after initiation of illness. Most studies agree that it can go up to 14 days after you've contracted the disease, but there's few cases reported up to 21 days. So just have to be careful and assume everyone can transmit the disease. So this experts use what you call roll number, to determine how fast a disease can be transmitted, can pass from a person who's infected to some other person, and how many person can be infected by that person. So on average for coronavirus, it's about 2 to 2.5. So one person can basically transmit about 2.5 to 3 people. However, that depends where you are. If it is overcrowded places, because that will increase significantly. So that's why social distancing is quite important. If you look at the comparison, H1N1 is about 1.2 to 1.6. While Ebola is 1.6 to 2. Just give you an example of different disease. Obviously, measles is a very contagious one compared to most of them. And if you don't do your social distancing and other measures, obviously the numbers increase exponentially significantly. So just this slide that to show you that you can, when you are contaminated, you can start showing signs between your incubation period about 2 to 4 days, but mostly on average 5 days, but it can take a bit longer than that. So who at risk of, we know that most people, 80 to 85% will do well without a problem, but this is the group at risk. Age is a significant risk. As you can see on this slide, so the more older you are, the chance of you dying is higher, with up to about 15% when you are over 80. People who have comorbidities, who have some other disease or conditions, can have significant also severe disease. And most of these is cardiovascular disease, diabetes, higher blood pressure, and the chronic respiratory disease and cancer. However, I think on this list should add sickle cell disease. Many countries have done that, including the US and the UK, because of the reason I will explain to you shortly. Now, why are we concerned about sickle cell and coronavirus? First, it's an unknown disease. We don't know it very well. We don't understand it. And we don't know what will happen in a couple of years. We're still all learning. Secondly, the symptoms the sign can be similar, it can be misleading, and some patients may not recognize it. Thirdly, both conditions can impact each other in a negative way and make things worse. And the last reason is that the condition have some similar mechanism, particularly on your blood vessels, because it leads to abnormality of your blood vessel or dysregulation, which both sickle cell and COVID may have, and that can be extremely dangerous. So if you look at comparison of signs, so most importantly, you can see that both can give you trouble, breathing trouble, so difficulty of breathing, with chest pain, and if you don't pay attention, you may think that you are having a chest crisis while also you're having coronavirus. Just remember that both also can give you fever, and both can give you pain, although sickle cell will give you more pain. But there's some reports from COVID or a patient who have leg pain as well. So it is important when you have a sign to get tested so that you know where to go. So this can be confusing because the two can do that. Now, how can COVID affect your sickle cell disease? So we know that one of the precipitating factors for your sickle cell crisis is low oxygen level in your blood. And we all also know that if you've got pneumonia, you've got COVID-19, you can drop your oxygen level in the blood, which can lead to your blood, sickle cell, hemoglobin, or red blood cells to sickle. So it will be sickling, and of course, from there, you block your vessels and you have manifestation of crisis. Also, when you're sick with any virus or COVID, your oral intake can reduce and your dehydration status will impact on your sickle cell. We also know that inflammation can be a precipitating factor for your crisis, for sickle cell crisis. And we also know that sickle cell also has a background of steroid inflammation, which is ongoing. So if you add this secondary inflammation, of course, things we just don't want to get worse. And the last one is the coagulopathy. There's the concern now, cases reported throughout the world, particularly in Europe, in Ireland, in France, about coagulopathy. So blood abnormality, clotting abnormality, making small clot due to coronavirus. We don't understand very well what that is the cause, but we think that is all linked to one pathophysiological mechanism of COVID-19. But this needs to be determined. Also in children, there were some cases, Kawasaki disease is an inflammatory condition mainly affecting children, which has been noticed in France and in Europe. A number of cases unexplained, a typical way of kids having significant inflammation and abnormality for blood clotting. So this remains to be determined to see what exactly is the underlying mechanism. We also know that sickle cell patients have relatively immune dysfunction because of your spleen function, which is reduced, making sickle cell people at risk of infection. The adult of sickle cell disease, or some children may have also heart condition related to sickle cell disease or to some iron overload, and that can put you also at risk when you have additional COVID-19 condition. So in Australia, we don't have much data at the moment. We don't have a registry, but US have published a number of data. This is from the 22nd of May. You can see they're able to count about 188 patients with sickle cell disease who developed coronavirus. And the Black African American were the most affected. Understandably, because of the ethnic at high risk, most likely, but also some other factors, including social factors, and in addition to some other comorbidities, such as type 2 diabetes or hypertension. I won't go through this because of the time frame, but that's where you get more data. And the mortality was about around 7% of this. There was an increase on blood transfusion requirement among those patients. But I think most information need to come. But I want to highlight this. So the younger patient did relatively well. So patient below 19 years of age, mortality was less compared to those above, significantly less compared to those above 19 years of age. So this is just a few data from UK. This is just like 10%, 10 patients will publish and see what they are doing. I think 9 out of them survive and only 1 dead. But the one who died has significant comorbidity. He had neurological deficit related to previous stroke. And he was basically totally dependent patient in a nursing home. Rather than that, I think here overall, the prognosis was good because 9 survived out of 10. So I guess the most important thing to remember that we have to be very, very cautious because we don't know the disease very well and we don't know what its impact on sickle cell. So you have to be prepared. So make sure you have what you need, including have a thermometer at home, have an adequate supply of your regular medications. Most importantly, apply your prevention measures. So stay at home unless if it's really necessary to go out. And you have to practice physical distancing if you have to go home. So maintain at least 2 meters between you and another person. So you have to make sure that you understand other prevention measures, including washing your hands properly, using water and soap, but particularly after touching anything or anyone out of your house, or any surfaces where usually people touch, and sanitize or disinfect it on a regular basis. So washing hands, you have to apply principle of hand hygiene. It has to last at least 20 seconds. It's difficult to looking at the watch, but you can do, there's 2 ways you can do it. You can either sing your happy birthday twice. That basically will last you about 20 seconds. So stay healthy. So even if you're at home, we can still do minimum exercise, but not excessive exercise. And don't be isolated. So you can still communicate through social media or through technology. Stay in touch with your hematology team or your treating team and your regular GP. There's no need to be changing doctors because it just creates a lot of confusion. So stick on it to your team, ask them for advice. If you are well, get in touch with them. Don't always rush to the hospital unless it is an emergency. Talk to your team to avoid, they can advise you what to do next. Listen to the local health authorities and public authority officials. Just remember that things can change very quickly. All this information can change very quickly because it's a new disease and we don't understand. So maintain you can keep your isolation, physical isolation, but you can still be socially connected through technology. Now, you have to protect yourself, and also you have to protect the community and other people. So stay at home if you are not feeling well, or if you don't need to go out. You can cover, when you cough, cover your of course, your nose and your mouth with a paper, a serviette, or you can use your elbow to sneeze, and keep your distance right. It's 2 meters at least, just to remember that. So avoid touching your face. So when you get your virus does not have legs. So you basically bring it yourself with your hand to your eyes, to your nose, or to your mouth, or also by going and being close to other people. So if you avoid all these things and wash your hands regularly, you need to practice how to wash your hands and stick to the recommendation. So use soap and water or sanitizer for at least 6% of alcohol base. So first I have to emphasize that COVID-19 is real, because there's lots of misleading information on social media. Unfortunately, some other parts of the world, I think in Africa, say it's not really, cannot affect Black people. So all these are not true, so it is real. Even if the curve has been flattened in many countries, but just remember that the virus is still there, and potentially we can have a second wave. There is other countries, it's still going significantly higher, such as in the US, although it's flattening, and particularly in South America. So we're not yet there yet. So, and remember, there's no cure for that. There's a lot of research going on, a lot of work, and we haven't had a vaccine yet. So we're still vulnerable, and the community has no immunity yet. So those things I still have to be in your mind, that we're still at risk, and take extra caution. All right, so stay safe and well, and I'm happy to answer some of your questions which you have. Thank you very much for your time, and we'll continue this discussion to your questions.
It's a pleasure to be here today, and I'm calling in from San Diego, a non-profit as well called Putting Rare Diseases Patients First, and that's how I connected with Agnes. And we did a program last week on sickle cell anemia, the new frontier, new cures, and really wanted to hear this presentation to see what the co-influence of COVID-19 might be. So I'm very intrigued on what's going on over the world, actually. So just wanted to catch up on this and learned a few new things. So that's very helpful. And I think at this moment, as we open up as societies, it's really important not to live in fear. So I think there's a lot of fear around as well, and we're still learning about the disease. And I do understand that there are challenges for anyone with any underlying condition. So it was helpful to hear Dr. Kalumba's presentation today, and I wish everyone to be safe and well. Thank you very much, Agnes, for inviting me. Thank you.
Thank you for having me, and welcome everyone to this, amazing conversation. So my name is Janika Leah. I'm an award-winning author and specialist speaker on sickle cell, mainly in the UK. I also run a publishing company helping first-time writers to bring their stories to life. So I was born with sickle cell anemia, SS. I live with the condition, but when I was growing up, I didn't really understand my condition. And so that was something that motivated me to write my first children's book, because I wanted to give children growing up with sickle cell the peace of mind that I didn't have. And so I launched my first children's book in 2016. And since then, the series is growing. We launched the second one in this year, 2020. So it's good and it's growing so far. I connected with the Australian Sickle Cell Advocacy, online, and was really, I will share this with you guys for the first time. I was really glad to see that there was an advocacy group set up in Australia. I actually traveled to Australia in 2016 while I was writing my book, and I had a terrible time at customs at the airport in Sydney and was accused of making up the condition of sickle cell anemia. So I'm really, pleased to see when I've seen, your presence online and how it's growing. I think it's very important that, it's something that affects everybody around the world. And so I know your numbers there are growing, and I think it's really special that you guys have this advocacy group and that you're spreading the awareness, because I can definitely say that it's needed in that part of the world. So I am from the UK, and as you guys may know from the news and everything, our rates of COVID-19 have been significantly high. I think at the moment we're confirmed cases around 267,000 mark, and we're around 37,000 deaths, and that's of course still growing. We've been in lockdown since the end of March. The 23rd of March was the official lockdown date, and we were supposed to come out the middle of June. It's now been pushed back to the 30th of June, with a couple of industries slowly starting to return to work. So for someone living with sickle cell anemia in the UK, and of course having to go through this experience, I think the initial concern that a lot of patients had was the fear and the worry. And I think that it's fair to say that that would go across the board, in terms of nobody really understood this virus, and nobody really understood what the impacts would be. As Dr. Kalumba, mentioned in his presentation, one of the main factors for patients with sickle cell was the risk of acute chest syndrome. And so because of COVID-19 having similar effects affecting the breathing, and for those living with sickle cell, acute chest syndrome is a very serious complication that can be life-threatening. So because of those similarities, I think that was a main worry for a lot of patients. Also as well, the fact that, viruses and those sorts of things can trigger a crisis. And of course, we are known to have quite low immune systems, and there was facts saying that COVID-19 will affect those that, it kind of, attacks your immune system as well. So those are the things that I think were the initial fear and worry among, people living with sickle cell within the community. I think the advantage we've got now and the changes that we've seen is that we do know a few people that have had COVID and have survived COVID, and a few of them have been sharing their stories in the media and in the press. And I think that has relieved a lot of pressure for a lot of people living with sickle cell to know that we can actually survive. I know that Dr. Kalumba mentioned some statistics there, and I was part of a webinar last week with a Dr. Noemi Roy from Oxford. She did mention that from the statistics, there was only severe cases, and this was across the board, not just in sickle cell, but in a range of inherited anemia conditions. So across the board, there's a 92% recovery rate. So it's really low, which is good for us. But of course, it's important that we do acknowledge that sickle cell does fall into the high risk group, and there are definitely more reasons for us to make sure that we're careful and that we're shielding. So with regards to shielding in the UK, not all patients have been shielding. Shielding is what they're calling it, or cocooning, where we don't have any symptoms, but we're, staying inside to protect ourselves and our health. And so, we had letters sent out which, gave us clear instructions how to keep our distance, and even just keeping away from people that are in the home that may still be going out and about doing the shopping. But as Dr. Kalumba mentioned, it's just about being careful, washing our hands often, and, keeping our distance where we can. There are a few people that have chosen not to shield, and I think it's fair to say that asking people to stay inside for, initially it was 12 weeks, and the actual instructions were to not go outside at all and just open a window. Now, I mean, it's bright weather over here, and being cooped up in a place, some people don't have their own personal garden spaces. Some people don't even live, they might live in shared accommodation. So to ask people to stay inside and not go outside for a number of weeks, that can have a huge impact, especially on our mental health. So one thing I will say for you guys with, kind of numbers rising, and just as a way of advice, it's that as long as we're sensible, if you can possibly, perhaps go stand outside the front door for some fresh air or anything like that, it will make a complete difference to how you are feeling mentally and also emotionally, because this is a really difficult time. And I also believe that a sense of community is definitely something that you'll see improving and bringing everyone together as well. So just ways to stay positive and not to stress. There are figures to suggest that ongoing stress can actually make us more susceptible to illness, and we know that stress can also be a trigger of a crisis. So it's really important in this time that we find ways to manage how we're feeling and try and remain calm and not to worry too much. There is also research that can show that, stress can also have an effect on our immune systems as well. So it's about not worrying too much. There are people out there with sickle cell that have had COVID-19, they've lived through it, and they've lived to tell the story. And the encouragement of those people sharing their stories is something that will alleviate some of the worry and pressure from a lot of patients as well. So just a few tips on what people could do to perhaps pass the time, as we're in week, I think it's 10 now perhaps, so I've been doing this for a number of weeks. So just to share some things that I've been doing, and I've been sharing this across my pages as well, trying new things. So I've recently started a new podcast. Writing, I find, is really good. And one of the things that I have launched across my children's book series on our blog is a community blog space. So for patients, people living with the traits, advocates, basically anyone that has any affiliation with sickle cell to get involved in sharing their, you know, lockdown stories or their quarantine stories. It could be related to the virus that's going on at the moment. It could be completely unrelated, but it's just encouraging others to share their stories, and that way we can support each other through whatever it is we're going through, and also help each other to get through this difficult time as well. I'd just like to point out that I know we can take time to rest as well. It's not always go, go, go. So, you know, balance your time between resting and also finding new things to do. It is a good time, however, to think of things perhaps going forward. There might be a new normal, which we're noticing here in the UK coming out of lockdown, but still having a lot of things that are moving online. So perhaps there's things that you're still able to do, hobbies that you could perhaps turn into businesses now that there's online things. In the last recession that took place within 2008 to 2010, there were companies like WhatsApp, Groupon, Instagram. All of those companies were actually born out of, you know, another recession or difficult time that we had. And I think it's fair to say that this perhaps may be a similar sort of time that we're going to be experiencing. So it doesn't have to be all doom and gloom. I am someone that is, you know, very positive and sees the silver lining in every situation, but it's good to have that balance sometime. And I think one of the things that I also think is really good for us as patients, and how this will, you know, encourage us going forward, is also to help us to take more responsibility of managing our conditions at home. And now I don't mean this in a sense of not going to the hospital. We do have patients in the UK that are still having transfusions, having blood exchanges, and having the regular treatments that they need. And they're being able to do that safely. However, for some patients, I think it's been a lot more time for them to kind of understand their bodies, and perhaps there are times where they can manage their pain at home and don't need to go to the hospital, whereas before they perhaps would have. So taking that responsibility on ourselves, thinking about our health, what we're eating, our diet, what we're drinking, and all the good things that we can do to help our bodies to kind of, you know, be strong on our own through this time. So all things that are really important, and things that we can consider actually, because we know that the healthcare, they're going to be under a lot of pressure. So thinking about things that we can do to help ourselves as well, such as foods and juices that we can have to boost our immune systems, and just those things, I think is important, something that should continue after this point, not just specifically because this is happening, but it may be a way that we can increase our manageability of our health as well. So I tried to kind of cover all aspects, but I'm here to, you know, answer any questions that anyone may have regarding anything that I've mentioned, or any of the experiences that we've had in the UK at the moment, since I think we're slightly ahead of you and definitely high on numbers here. So I'm happy to answer any questions that may follow from that. Thank you.
Thank you, Dr. Kalumba, for that great presentation. It was very informative. And it's always nice to hear, to have some informed, you know, some evidence-based information, you know, to support us during this period. And to Janika as well, that was really great. Some great advice for people who are affected by sickle cell disease. So I have a few questions for both Dr. Kalumba and Janika. So for Janika, so far, there is one question that has come through where people are interested in knowing how they can get hold of your books on living with sickle cell disease, especially for children, and any of your social media handles. So if you could share those, that would be really great.
Okay, yeah, that's no problem. So my children's book is called My Friend's Jen. I don't know if I can...
Yes, you can definitely type that in to the chat, and we'll definitely record that.
I will. This is our website. I don't know if everyone can see this, but...
We can, yeah.
So My Friend Jen, it's the book series about sickle cell. And if you go to buy our books about sickle cell, you can see both of the books in the series there. The first one is yellow, it's called A Little Different. And the second one is purple, and it's called The Checkup. So if you type in myfriendjen.co.uk, that is the website. And on the website as well, you can see all of the social media links there. So I think that's probably the easiest way for anyone to get in touch with me is on the blog. And you can also find out more information about being a part of our community blog on here for anyone that has any affiliation with sickle cell to kind of share their stories. So we'll be sharing a story every month or so to kind of, start to make that connection and build that sense of community.
Yeah. Thank you very much for that. I am definitely sure that a lot of parents will appreciate having such resources, because we do know that dealing with sickle cell disease can be challenging enough. So it is nice to have that voice from someone who has actually lived through it. And my next set of questions are mostly for Dr. Kalumba, and there is quite a number of them. Okay, so starting with the first one, it's come through asking, what risks do I need to watch out for my daughter who is living with sickle cell disease?
Yeah, thank you very much. So I think the risky, how old is the daughter?
The person has not specified. I would probably take a guess. Might be a school-going child. Most likely, that's where the concern might come in as well.
Sure. I think for any patient with sickle cell disease, the risk is with this period of time, if you get COVID-19, you certainly have additional risk or potential risk of triggering your crisis in many ways. Because if you get an infection, it can trigger your vaso-occlusive crisis. It may put your fluid intake down for your daughter, and therefore she may be relatively dehydrated, and also that will lead to a increased risk of vaso-occlusive crisis. And secondly, because the sickle cell disease is not only sickling, we now know there's more to it. So there is a sterile inflammation which is ongoing, and those additions of the blood cells, including white cells and platelets, to come and stick together. And those things will increase obstruction of your vessels and will prone to more crisis. Now, we also know that COVID can lead to abnormality for your vessels, how it functions. So you remember that normally your blood cells should not stick inside your vessel, your blood vessels should be flowing freely. But if they're sticking together, then they block the vessels and you have crisis and more complication. So the risk is there. The most important way of preventing that risk is prevention. For the moment, the only evidence we have against coronavirus is prevention. And the way you can prevent it is by following and applying the prevention measures, including social distancing, hand hygiene, and of course, stay healthy. And if you are concerned, you should be able to communicate. You should talk to your treating team. So we can't really quantify. If you look at coronavirus mortality rate or case fatality rate, normal people who are not old, the young population is about 1.3, sometimes up to 3. But if you look at the way more we get older, it increases up to 15% over 8 years. But if you look at the cohort from US, we have a mortality rate of 7% plus. So, which is, if you look at that 10, although it's a small cohort of 10 patients from UK, so one patient died over 10, that's about 10%. However, that patient was already a high level of comorbidity. So all depends also which comorbidity your daughter has. And then, so that's
So Dr. Kalumba, sorry to interrupt you, and also just for the sake of time. So to summarize, can we basically say that this person or any other person should basically ensure that they are always in contact with the treating doctor to ensure that they are getting the right advice, and probably and possibly also follow the current health guidelines from authorities to make sure that they are also keeping up to date with those. And I probably would also add that mental health is very important around that. So possibly, I would say for a person affected by sickle cell disease, take the best care of yourself as you normally would, you know, so keeping hydrated.
Yes, and I will add probably, so you have to be calm. So I think what I'll say, be calm, but do the right thing. Do what you're supposed to do. So apply those measures. So the good thing about this virus is that it can't just come and get you. So there's a way you can basically prevent it coming to you, particularly if you know that you have additional risk factors.
Okay.
So the issue of masks, normally there are different types of masks. So in the hospital base, what's called surgical mask, which is probably equivalent to the mask of, if you probably the tissue you use, it does not protect you from getting the disease. Okay, that it prevents you spreading the disease. So if someone has no mask, when he talks or has got some droplets or cough, he can basically push away viruses. But if you've got a mask, obviously you don't want to do so. So it will remain there. But if you get that mask from a tissue, a fabric, and you are in touch with someone who's infected, you can be infected if the distance is not recommended. The only mask which can prevent you not being infected or reduce the risk is what we call N95 mask, which is different from surgical mask. Even the surgical mask from the hospital does not protect the personal weight, but it prevents the personal weight not to contaminate another person. So that's why a number of countries recommend when you're in public, if you ever wear a mask in public, then you reduce the risk of passing the infection. But if someone does not have a mask and you have a fabric mask or surgical mask, you don't protect yourself, you prevent you. So that must help prevent you of getting your virus out to someone else. And how long do you wear it? Normally it's recommended every 3 to 4 hours you should change your mask. And it's important to know how to wear it, because we've seen some other people, the way they wear the mask, then they will keep touching the mask and, you know, outside, then put it in the hand because it's not comfortable, try to adjust it. So you may end up infecting yourself.
So difficult because we are used to that.
So it's important because even I've seen in many countries, even authorities showing how to wear a mask in a wrong way, and how when you remove it too, you have to remove it properly. So and you do your hand hygiene, then take your mask out and put it in the bin, and then do your hand hygiene again. So if you don't follow those steps, your mask can be a source of infection. I had an authority from somewhere, I think African country, saying you can keep it 3 days. So I mean, then obviously that's become something else.
Hi everyone. Can you hear me?
Yes.
Okay, good. Hi, I'm Isabella and I'm from Queensland. I have 3 children, 2 which have sickle cell beta thalassemia. My son actually presents as a sickle cell patient, has sickling crises quite often, has had since he was about 18 months old, probably earlier. In hindsight, he's now 27 years old. And I have a daughter who's 28 years old, who presents more like a thalassemia intermedia, but has recently, since she's had her baby, has been experiencing some type of sickling crisis. I'm here today because I'm quite interested to listen to everybody's stories, and I'm very excited because we've been living with this for you know, the better part of the 28 years, and have not really come across very many people that do have sickle cell here in Australia. Only since I've met Agnes have I met meeting all of you, made me feel quite, I don't know, I guess, happy. And with their treating, someone was saying before, coming to Australia and trying to prove that they had this sickle cell anemia. We do this all the time with GPs and have been doing this for 28 years because a lot of people do not know anything about it. In fact, when they were diagnosing my eldest daughter, they thought that she had some form of leukemia. So we have been through a lot and have been going through a lot. I have been part of some associations, but because they didn't fit the square or round hole, we weren't getting the information that we needed to try and move on. So we've self-educated ourselves, basically. We have now a grandbaby who's a carrier of sickle cell, and I have another grandbaby on the way. My son's partner's having a baby, so there's another little baby coming along the way. A lot more education coming from them. I do have a question for Dr. Kalumba. From listening to your presentation, which was fantastic, by the way. I just wanted to know if you have a theory and how long you foresee social isolation for those people that do suffer from sickle cell anemia. My children have both self-isolated from the very first day. They've probably been in self-isolation for about 12 weeks. My eldest daughter is working from home because she's able to, whereas my son is not able to work from home. They don't go out unless they really, really have to. I wanted to know from you, or from your experience or from your research, how long do you foresee social isolation for those people that suffer from a hemoglobinopathy?
Yeah, thank you for a great question. So I think it's hard to say, but if you've got a family who has been self-isolated for 2 weeks, so let's say you have two families, so you have members here, going out, not going out.
Yeah,
you should be safe after 2 weeks.
Yes.
If nothing happened, it should be okay for you to be together, as long as both two groups are self-isolating.
Yes.
But if someone has been going out, then coming in, then that is difficult to say it's safe for you, because we don't know where it's going, and depending where it's going and which kind of measure is taking to myself, when I go home before so all my clothes from the hospital go somewhere.
Yes.
Have a shower, then change and
of course
come out. It's still a risk, but my wife, there's not much she can do about it. But if you have to, certainly someone from the family is going out, then unless if sure is going in the office and there's no risk of him getting some other, being contaminated. The problem with COVID that we don't know who can transmit.
Yes. Well, the doctors have spoken to, like, my children obviously liaise with their own hematologist, and they've been told that they should still continue to social isolate. With my daughter, for example, they've given them a bit of a timeline up till August. And with my son, very similar as well. They do have to go out because they go out to get treatment. They have blood transfusions every month. So they need to so they do have to go out in those kind of cases.
That's right.
Obviously not within the community.
Yes.
Like go out to the cafe.
Most of the in Australia, they've got there are steps to prevent these. Being cautious, really, like every single patient who suspected is going to be tested, isolated until it's cleared. So there's things going. There's still risk, but some of the hospitals, once you come to the hospital, it becomes a risk, because you don't know when you're in the hospital or whatever, so you can catch something. But I think you just have to be cautious. Obviously, life has to go on.
Yes.
Life has to go on at some point. But just have to be cautious. I think distancing, even if you're going out, is a matter of making sure you get a bit of distance between you another person. It's not always possible, but
Yeah.
we can only do what we can to try to prevent.